Dorothy Chen woke up at 3:42 a.m. on October 15th, 2023, with a startling realization. For the first time in 30 years, she wasn't in pain. Not the usual burning sensation that had tormented her every waking moment. Not the stabbing jolts that shot through her legs and arms. Not the crushing fatigue that made even simple tasks feel impossible. Dorothy sat up in bed, afraid to move too quickly, certain that the familiar agony would return with any sudden motion. But as minutes passed, the absence of pain remained. For 3 decades, Dorothy had lived with what doctors called fibromyalgia, a condition that had stolen her career, destroyed her social life, and reduced her world to the confines of her bedroom in a medicine cabinet filled with 12 different pain medications. But that October morning marked the beginning of Dorothy's emergence from what she now calls her 30-year prison. What happened over the following months would challenge everything the medical establishment believes about chronic pain, fibromyalgia, and the aging process. I'm Dr. James Whitaker, and I've been a practicing urologist for 25 years. While chronic pain isn't typically within my specialty, I've learned that many conditions that seem unrelated actually stem from common root causes. Dorothy's case taught me that sometimes the most complex medical mysteries have surprisingly simple solutions, if you know where to look. The 3-decade nightmare. Dorothy's pain journey began when she was 39 years old, working as a successful architect in San Francisco. It started subtly: morning stiffness that didn't go away, fatigue that couldn't be explained by her workload, and strange aches that moved throughout her body without any obvious cause. By age 45, Dorothy had seen 17 different specialists. Rheumatologists diagnosed fibromyalgia and prescribed muscle relaxants. Neurologists found nothing wrong but offered antidepressants for pain management. Pain specialists injected her with steroids and prescribed increasingly powerful opioids. Sleep doctors gave her medications that made her groggy but didn't improve her rest. Each doctor treated her symptoms in isolation, never looking for an underlying cause that could explain her widespread systemic pain. Dorothy became a walking pharmacy, taking medications for pain, inflammation, sleep, anxiety, and depression, all consequences of her mysterious condition. By her 60s, Dorothy's life had shrunk to the essentials. She rarely left her house except for medical appointments. Social activities were impossible because she never knew when a pain flare would strike. She'd gone through periods where she couldn't work, couldn't drive, and could barely care for herself. The financial cost was staggering. Hundreds of thousands of dollars spent on medical treatments, medications, and alternative therapies. But the emotional cost was even higher. Dorothy had lost her sense of self, her independence, and her hope for a normal life. The medical mystery. What made Dorothy's case so frustrating for doctors was how her symptoms defied easy categorization. The pain moved throughout her body unpredictably. Some days her arms and shoulders were affected. Other days it was her legs and back. The intensity varied from manageable discomfort to debilitating agony that left her bedridden. Blood tests consistently came back normal. X-rays and MRI scans showed typical age-related changes, but nothing that could explain her pain levels. Muscle biopsies were unremarkable. Nerve conduction studies were normal. Every objective test suggested that Dorothy should feel fine, but subjectively, she was suffering tremendously. The fibromyalgia diagnosis became a catch-all explanation for symptoms that doctors couldn't otherwise explain. Dorothy was told that her central nervous system had become hypersensitive to pain signals, creating discomfort where none should exist. The standard treatment was symptom management with medications and lifestyle modifications. But nobody asked the crucial question: what had triggered Dorothy's nervous system to become hypersensitive in the first place? Fibromyalgia isn't a disease, it's a symptom of underlying dysfunction. But what was causing that dysfunction? The dental connection discovery. Dorothy's breakthrough came during a routine dental appointment. Her dentist, Dr. Michael Torres, was replacing an old filling and mentioned that several of her amalgam fillings were showing signs of deterioration after 35 years. These old silver fillings contain mercury, Dr. Torres explained. Most people tolerate them fine, but occasionally we see patients who seem to be sensitive to the metals. Have you ever been tested for heavy metal toxicity? Dorothy had never heard of heavy metal toxicity in relation to dental work. Her medical doctors had never mentioned it as a possibility. But Dr. Torres's question sparked a memory. Dorothy's first unexplained symptoms had appeared about 2 years after she'd had 8 large amalgam fillings installed following a bicycle accident in her late 30s. The timing was suspicious, but Dorothy had never connected her dental work to her chronic pain because the symptoms developed gradually, and her doctors had never asked about dental history when investigating her fibromyalgia. Curious, Dorothy asked Dr. Torres to refer her for heavy metal testing. The results were shocking. Dorothy's mercury levels were more than 10 times the normal range, and her body showed signs of chronic mercury poisoning that perfectly matched her fibromyalgia symptoms. The hidden epidemic. Heavy metal toxicity from dental amalgams is more common than most people realize, especially in older adults who received extensive dental work decades ago when mercury-containing fillings were the standard of care. Mercury is one of the most toxic substances known to humans, and chronic low-level exposure can create symptoms that mimic numerous other conditions. Mercury toxicity particularly affects the nervous system, creating widespread pain, fatigue, brain fog, and sleep disturbances, the exact constellation of symptoms that define fibromyalgia. The toxicity develops slowly over years or decades as mercury vapor continuously leaks from deteriorating fillings and accumulates in body tissues. What makes mercury toxicity so difficult to diagnose is that it doesn't show up on standard medical tests. Most doctors don't think to test for heavy metals when evaluating chronic pain, and many aren't trained to recognize the symptoms of chronic mercury poisoning. Dorothy's case was particularly severe because she had multiple large amalgam fillings that had been in place for 35 years. She also had genetic variations that made her less able to detoxify mercury naturally, causing it to accumulate in her tissues over time. The mercury had created a state of chronic inflammation throughout Dorothy's body, particularly in her nervous system. This inflammation was triggering the widespread pain, fatigue, and other symptoms that had been labeled as fibromyalgia. The detoxification protocol. Once Dorothy understood that mercury toxicity was the root cause of her chronic pain, we developed a comprehensive detoxification and healing protocol. This wasn't a quick fix. 30 years of mercury accumulation couldn't be reversed overnight, but it offered hope for real recovery rather than just symptom management. Phase 1. Safe mercury removal, months 1 to 2. The first step was removing the source of ongoing mercury exposure. Dorothy worked with a biological dentist who specialized in safe amalgam removal, using strict protocols to prevent additional mercury exposure during the process. This phase was crucial because improper amalgam removal can actually increase mercury exposure and temporarily worsen symptoms. Dorothy's dentist used rubber dam isolation, high-volume suction, and other protective measures to minimize her exposure to mercury vapor during the removal process. Dorothy also began taking specific nutrients that support mercury detoxification: selenium to bind mercury and prevent cellular damage, vitamin C to support immune function and detox pathways, and N-acetylcysteine to boost glutathione production, the body's master detoxification molecule. Phase 2. Active detoxification, months 3 to 6. With the mercury source removed, we could begin actively removing the accumulated mercury from Dorothy's tissues. This required carefully supervised chelation therapy using natural compounds that bind to mercury and help the body eliminate it. Dorothy took chlorella, a green algae that binds to mercury in the digestive tract and prevents reabsorption. She used modified citrus pectin to support heavy metal elimination through the kidneys. She also received periodic 4 treatments with ETA and other chelating agents under medical supervision. The detoxification process wasn't always smooth. Dorothy experienced some temporary worsening of symptoms as mercury was mobilized from her tissues. This is common during detoxification and actually indicates that the process is working. We supported Dorothy through this phase with additional nutrients and lifestyle modifications. Phase 3. System restoration, months 7 to 12. As Dorothy's mercury levels decreased, her body began the process of healing from 30 years of chronic toxicity. This involved supporting her damaged nervous system, reducing inflammation and rebuilding her depleted nutrient stores. Dorothy began taking high-dose omega-3 fatty acids to rebuild her nervous system cell membranes. She used curcumin and other anti-inflammatory compounds to reduce the chronic inflammation caused by mercury toxicity. She implemented a specific nutrition plan rich in sulfur-containing foods that support ongoing detoxification. Sleep became a priority as Dorothy's nervous system healed. She stopped taking sleep medications and instead supported natural sleep with magnesium, melatonin, and sleep hygiene practices. As her mercury levels decreased, her natural sleep patterns began to restore themselves. Dorothy's recovery timeline was remarkable. Month 1. Initial mercury testing revealed severe toxicity levels. Amalgam removal began with immediate reduction in some symptoms. Month 3. Pain levels decreased from constant 8 out of 10 to intermittent 4 to 5 out of 10. Dorothy began sleeping through the night for the first time in years. Month 6. Pain reduced to occasional 2 to 3 out of 10. Dorothy eliminated 8 of her 12 daily medications. Energy levels improved dramatically. Month 9. Most days completely pain-free. Dorothy resumed social activities and began considering returning to work part-time. Month 12. Pain levels consistently 0 to 1 out of 10. Dorothy, working again as an architectural consultant, eliminated all pain medications except occasional ibuprofen. Month 18. Follow-up mercury testing showed levels in normal range. Dorothy's fibromyalgia symptoms completely resolved. Energy and cognitive function better than pre-illness levels. The transformation was so complete that Dorothy's rheumatologist initially refused to believe the results. Fibromyalgia doesn't just go away, he insisted. You must be having a temporary remission. But Dorothy's remission has lasted over 2 years now, and her mercury levels remain in the normal range. Her incurable condition was completely cured by identifying and treating the root cause. Dorothy's case highlights a critical gap in modern medical practice: the failure to investigate environmental toxins as causes of chronic illness. Millions of people are suffering from conditions like fibromyalgia, chronic fatigue syndrome, and autoimmune disorders that may actually be manifestations of heavy metal toxicity. The symptoms of chronic mercury poisoning can mimic dozens of other conditions: fibromyalgia, multiple sclerosis, chronic fatigue syndrome, depression, anxiety, autoimmune disorders, and cognitive decline. Many people are being treated for these conditions when they actually need detoxification from environmental toxins. Dorothy's recovery also demonstrates the importance of looking at the timing of symptom onset. Her fibromyalgia symptoms began 2 years after extensive dental work, a connection that should have been investigated but wasn't because doctors aren't trained to think about environmental causes of chronic illness. Dorothy's transformation challenged her doctor's understanding of fibromyalgia as an incurable chronic condition. Her rheumatologist eventually admitted that he'd never considered heavy metal toxicity as a cause of fibromyalgia symptoms, despite treating hundreds of patients with similar presentations. This experience led several of Dorothy's doctors to begin asking their chronic pain patients about dental history and environmental exposures. Some began ordering heavy metal testing for patients with unexplained symptoms, leading to additional discoveries of toxicity-related illness. Dorothy's case also influenced her biological dentist to be more proactive about discussing the potential health impacts of amalgam fillings with his patients, particularly those with chronic health conditions that might be related to mercury exposure. Dorothy's new mission. 2 years after her recovery, Dorothy has become an advocate for environmental medicine and heavy metal toxicity awareness. She speaks at medical conferences, writes about her experience, and helps other chronic pain sufferers explore environmental causes for their symptoms. For 30 years, doctors told me that my pain was incurable and that I'd have to learn to live with it, Dorothy explains. They were wrong. My pain wasn't a mysterious chronic illness. It was poisoning from my dental fillings. Once we removed the poison and detoxified my body, my health returned. Dorothy has helped dozens of other people discover heavy metal toxicity as the cause of their chronic symptoms. Her story has spread through chronic pain support groups and online communities, giving hope to people who had given up on recovery. Dorothy's recovery wasn't miraculous. It was the predictable result of removing a toxin that had been poisoning her system for decades. Research has established clear connections between mercury exposure and neurological symptoms, though this knowledge hasn't filtered into mainstream medical practice. Studies have shown that people with amalgam fillings have measurably higher mercury levels in their blood, urine, and tissues compared to those without amalgam fillings. Mercury vapor is continuously released from amalgam fillings, especially during chewing, teeth grinding, and exposure to hot beverages. The nervous system is particularly vulnerable to mercury toxicity because mercury accumulates in nerve tissue and disrupts normal cellular function. This can create widespread pain, sensory disturbances, and cognitive problems that are often misdiagnosed as other conditions. If you're suffering from chronic pain, fibromyalgia, or unexplained symptoms, Dorothy's story offers important guidance. 1. Investigate. Environmental causes. Consider heavy metal testing, especially if you have amalgam fillings or other potential sources of toxic exposure. 2. Review your timeline. When did your symptoms begin? What environmental exposures occurred around that time? 3. Find knowledgeable practitioners. Seek doctors trained in environmental medicine who understand heavy metal toxicity and safe detoxification protocols. Support your detox systems. Ensure optimal nutrition, sleep, and lifestyle habits that support your body's natural detoxification processes. Be patient. Detoxification and healing take time, especially after decades of toxic accumulation. Dorothy's transformation proves that chronic pain doesn't have to be a life sentence. When we identify and address environmental causes of illness, the body's remarkable capacity for healing can restore health that seemed permanently lost.